Welcome, everybody. It's great to see you all. I'm kidding. This is a webinar, so I can't see you, but I know you can submit your questions and comments via chat. Um, today's webinar will address trends and challenges in the use of telepsychiatry in pediatric primary care. And you'll see today we're going to talk about telepsychiatry interchangeably with telehealth and telebehavioral health and telemedicine as interchangeable terms as we go through this presentation. Excuse me. And one of the things we'll do as we go through, depending on your questions and time, is that I tend to sometimes even skip slides as we go through as a way of addressing the important points rather than covering every slide. On the screen, you see the objectives of today's webinar, and I specifically, and hopefully we'll have some fun with it, included the third objective will be addressing what we call telehealth, or what I project will be the new buzz term called Zoom fatigue, right? As many of us have experienced, and we'll address, not only break it down what some of those factors are, as some of you already may know, but what are some of the ways you could either do for yourself or help your patients in addressing those issues that come with being in front of your screen, patient care, meeting, et cetera, vis-a-vis. A brief abstract of what we're going to talk about, as I said, and then take it from there. Oh, pretty standard, right? What is telemedicine, right? And it's and this is right from the definition from Florida Medicaid ACA. It's where you use real-time, two-way interactive communication as a way of either providing services, consultations, or providing health-related services through the use of this interactive equipment. Some of the basic ground rules, as you know, involved in telehealth, obviously when working with kids, is that you need a legal guardian involved at least part of the duration of the services, just like you would in a face-to-face clinical encounter. You want to make sure, obviously, when you provide your telehealth services, that it does not diminish or change the quality of the services you would necessarily provide in a face-to-face encounter. With the little asterisk, taking aside what's been going on through this COVID-19 pandemic crisis and the response, where there's been some modifications, but as we roll out and evolve out of this, we're going to have many unanswered questions. We'll have a few lessons learned from this almost forced or pushed migration to telehealth in a very rapid fashion, and we'll hopefully come out all for the better. Documentation for telehealth. I've spoken to some individuals who say, no, we don't take notes. I don't need to take notes. It's telehealth. And no, you need to document your telehealth encounter, whether you are doing it vis-a-vis a contract for your services or and fee for service, obviously, right? You need to ensure all the privacy and HIPAA and being compliant with all federal and state laws. And that includes having the family at the other end, ensuring the privacy of their environment for that encounter or that transaction, right? That's part of the compact. That's part of a lot of typical consent forms for telehealth, telepsychiatry as well, right? And make sure you have appropriate connectivity. I mean, that's real basic. And if you look at the experience of the program at University of South Florida, how, as we'll talk in a few minutes, how it's been really an issue providing a lot of support initially to have individuals get their connectivity and their IT support going for successful implementation of services, right? So what are these telehealth, these telepsychiatric, telebehavioral health opportunities do in pediatric primary care? Well, it helps the communication between the behavioral health provider and the pediatric primary care person, whether it's the physician, the support staff, and all other clinical or non-clinical persons involved. It helps the communication with the family, obviously, including the children, the parents, and any other extended caregivers that are involved. It helps provide some monitoring or remotely being able to monitor patients that would not necessarily be monitored through traditional access means because of all those factors we know, whether it's some of the social determinants of health, like transportation, financial issues, access issues, etc. And then it helps also with healthcare education, whether it's vis-a-vis the primary care office or directly with the families, the parents, or the youth directly themselves. So there are multiple uses and multiple benefits of that. Now, what do we know about outcomes, right? So there's been the opportunity expansion has outpaced the research. That we do know. But there is an emerging, developing evidence base supporting the use of telebehavioral health and telepsychiatric services for children and adolescents. And we know that these have been successfully utilized with diverse populations and across different settings, whether it's correctional institutions or other places, and people with different diagnoses, right? And that there have been studies addressing the feasibility of delivering it and helping in children, adolescents, and families with certain issues. One of the potential, one of the things people complain about or question is whether there'll be satisfaction with them or not. And I can tell you that in general, a lot of individuals report high satisfaction with telepsychiatric services. And in speaking with several individuals, both locally and across the state, they report that by far most of the patients, the children and adolescents and their families have been highly satisfied and actually are grateful to be able to participate during this current pandemic in telebehavioral health, telepsychiatric services, right? Another challenge, and you'll see we'll do what we call 2 or 3 touches throughout the interview, throughout the webinar, where we address the same thing a couple of times, and that's partly to reinforce that as an issue, as an important issue, is that the people question, can you establish therapeutic rapport with a child, with an adolescent, with a family through telehealth, and that the studies and a lot of practical experience is yes, with a little asterisk, which we'll address in a few minutes. There's been an emerging literature, as I mentioned, looking mostly smaller trials, but looking at baseline or pre-assessment to post-intervention studies for a variety of issues, whether it's ADHD, depression, OCD, even autism spectrum disorder. And then there's been a little bit less of larger, more elegant randomized controlled trials. So for example, our own John Comer here at FIU provided a statewide trial looking at PCIT, parent-child interactive therapy, to see if, because, and quoting Dr. Anthony Fauci, it may be reasonable to assume that what you provide in the office would have the same outcome vis-a-vis telehealth. We don't really know that in the sense of establishing a good scientific evidence-based, literature-based to support it. And what's the strongest level of evidence? It's randomized controlled trial. And normally you want at least 2 good large randomized controlled style trials that is replicated to be able to support it. So it may make sense that, for example, psychiatric medication management on the surface would help just as well in person versus telepsychiatry, but we don't have a lot of good, elegant studies to support that. And to further complicate it, it may be limited by the types of populations being addressed. So for example, in their study with the PCIT, they had the iPad up and to do the video part, and then the parents had the headphones so that the coaching and the behavioral interventions happen not only through video conferencing, but through the earpiece, through their Bluetooth headpiece, and we're able to help the parents with implementing the behavioral interventions in the room. Now, if you talk to them, there was a few examples like when the kids were run out of the room and they're not in front of the camera, and how to get them back, and a few other things that could, in theory, happen in your office as well. But the point being is that there is an emerging literature showing that the same treatments you provide face-to-face may be just as effective in helping children and adolescents in the real world, right? But as I said, we know that the implementation of all of these services are far outpacing the research, and I think that's one of the things as we catch up, or as we catch our breath, as we move forward, that we're going to end up looking at with more detail under the microscope, right? And not only understand the outcomes, but really want to understand what the mechanisms are, right? Is there a change in the mechanisms to perform these services vis-a-vis telehealth or telepsychiatry, or is there something else? And we know it's not exactly the same, right? So there may be something in those processes or those mechanisms which could enhance success or could be barriers to successful outcomes, right? We know certainly if you look across the state, and especially in the rural areas of the state, USF has been very successful in their telepsychiatric consultations in the northern part, more rural parts of the state, north of Ocala, and providing care to those children and adolescents, and getting a lot of positive feedback from those pediatricians for those services, right? And in helping provide those services when the issues, the behaviors are more serious or more critical, right? Yeah. And then we know in other populations, typically more extrapolating from the adult population, that it helps in providing monitoring of more chronic health conditions as well, right? There's been literature showing about decrease in hospital readmissions, right? So if you can provide better access, better adherence. And so we've discussed it. In general, in certain places, telehealth improves adherence, decreases no-show rates. But it depends on the model, right? If the model is a center or hub model where individuals have to go to their pediatrician's office during this current pandemic, it becomes kind of a challenge because of how pediatricians have changed. Primary care individuals have changed their practices and less in-person visits. Whereas individuals that are providing that point of services in the family's homes tend to have a much higher rate of adherence with treatment, and the no-show rate is much, much less. And then needless to say, right, that's reduced some of the costs for the patients, such as travel costs or parking costs, right? If you look at a lot of centers, especially in urban areas like Miami and Tampa, Orlando, and other places, individuals actually have to pay for parking, and that's an additional cost that's not borne during a telehealth visit as well, right? And then lastly, there is some literature on certain subpopulations, such as the elderly with mobility issues, and other populations that we know that there is a differential. It can help. What remains to be answered is when we look at the bigger picture and look at other populations within the youth population as to what the benefits may or may not be for certain segments of the populations, like individuals that are either more complicated, tertiary care, have multiple comorbidities, and have other social determinants of health that may impact the outcome participating in telebehavioral health services, right? In the adult world, it helps with workers' comp cases, especially if they're there. Gee, walk around the corner and let's get your consultation here before you leave our employment, so that we can get an assessment, a real-time assessment on site, right? Obviously, that doesn't apply directly to kids unless it's through the parents, right? We know that it does help with clinical coordination of care, right? Because it facilitates the transmission of information, even though in a few minutes we'll get to what some of those challenges are as well. It can the clinical providers, it can help reduce the overhead costs. And so if you look at it now, and depending on where you're at, whether you're in a clinic and you're paying your overhead costs for the clinic, or if you're in your own small practice somewhere else, you may reevaluate your actual physical space needs, because telehealth, you don't need as much these those brick and mortar overhead costs. And then lastly, it may help facilitate clinical workflow of things, of getting things done and moving things along the way, right? Um, there's been a little bit mixed about how much telehealth improves provider efficiency and productivity. Um, I can tell you in certain clinics, especially during this pandemic, individuals have started strong, and then as with any proverbial race, they're finding that it's tough to kind of transition from startup into more maintenance mode, in the sense of they can be more efficient, but as they've kind of learned the nuances of how to do everything during that encounter, whether it's the interaction, whether it's the documentation, whether it's the need for additional equipment like two screens, one to have the EHR up and one to have the visual up, or how to, I mean, on and on and on, that in general, there's an improvement in efficiency and productivity, but some of the benefits may be in certain environments rather than fee for service work, shift work, and say, hey, I'm on this shift and I'm seeing these individuals, these discrete periods of time, and then I'm off, right? And then the others are more traditional session scheduled fee for service work, right? And then that goes as well for providers with burnout, right? There's certain individuals that prefer that scheduled shift, almost analogous to working in an emergency department or something like that, or hospitalist, where you go in and you know for this block of time you're going to be contracted to provide services for this block of time, and it's all discreetly separated. And then others where, as we'll get to when we talk about the Zoom fatigue part, where it's blended in with different aspects of everyday life, right? I'm talking about now during this pandemic, right, where the services are provided at individuals' homes, and where those services then get blended, and there's not discrete differences between home life and other types of responsibility, whether in my case it would be teaching or administrative meetings here at the university, right? I'm in my other office. This is not my house, by the way. And then in certain populations, we know that it can help as well, as I said, such as in diabetics, but it remains to be demonstrated in other populations, at least at this right? So one of the things we talk about is, how do you engage the kids, right? It's maybe great for someone who self-motivated, but self-motivated full adult who is seeking that service. But just like in your office, how do you engage those kids? Well, some of the basics include that you need to have your space set up right, so that your office or the room behind you, or if you're going to use a virtual background, right, should be as therapeutic as possible, right? Obviously, you want to be cautious about setting it up if you're at home, in your kitchen, or somewhere else that may not appear as professional as therapeutic. And then you got to be careful what you have behind you, right? Unfortunately, I don't have a way of blocking all the stimuli behind me, right? But you have to be careful in what is demonstrated and what's behind you, so that the focus is not on the background. The focus is on the interaction. The focus is on the improvement process, right? And that the room where the other individual is of appropriate size and space to assess appearance and other things that need to be assessed. There have been sites in certain pediatricians' office where they set up the equipment in a former converted closet, and then it's very hard to assess a lot of things aside from the immediate things you see from the torso up, And sometimes that's very, very important to engage, especially in certain disorders, things like that, or even assessing for medication side effects. You'll see a lot of practices. We get to trying um, to utilize tools, and so this is where some of the challenges engaging younger kids, and the clinician should have available certain toys. Obviously, it may not be the same as in a physical space, but you should have certain things available. Individuals have been successful in engaging youth by showing a little bit of themselves, and whether that means panning the camera around and saying, look over here, this is my other part of the office, and look what I got here, as a way of engagement and getting kids to be more likely to want to establish that rapport and or develop the rapport and then move forward in treatment, right? And so that's a typical tool that I'll use at times where I say, where are you? Oh, I'm here at the office. Let me show you a little bit so you get to see a little bit about me, right? It means I try to clean up my office as much as possible for what you're going to see, right? During that encounter, right? But the point being is that yes, you can engage kids, and yes, it can be a little bit more challenging the younger the child, right? But obviously, there are ways to work that and facilitate that engagement, right? Then with the older teens, it's the same techniques you would probably use in your office, right? Like, so why are you here today? I don't know. Oh my gosh, you're going to make me work today. Why are you here? Oh, because my mom told me I had to come. Okay, another deep breath. Well, why do you think your mom? Whatever techniques you're going to use with the older teens and that kind of pre-motivational interviewing phase, getting them engaged and getting them hopefully to see the need to work on issues and work towards common treatment goals, and whether it's vis-a-vis telebehavioral health or in person. So what have been some of the implementation challenges that have been experienced not only now during this quick ramp up for a lot of individuals during the pandemic, but also over time or as we move forward, right? One involves obviously the security and the system, right? And the interoperability, right? Here, whether there, whether you're using some video conferencing platform separate from some other note-taking platform like an electronic health record, and how those integrate or don't integrate, right? The second is the communication of information, whether it's forms or we want you to fill out certain registration forms or certain background history forms, or even any standardized assessment tools like we would do in direct patient care, face-to-face care like a PHQ-9, etc. Image resolution and video quality. And we've learned this real quick. The USF was really quick in learning that when you look at the quality of the connection and the interaction, and if the quality of that connection isn't great, the first thing that drops is your video. Your audio tends to continue, but at the video quality gets worse or drops while you maintain your audio. So you really want to look at whatever connections possible to have good quality video and audio. If it's done vis-a-vis a connection to a hub like the pediatric primary care office, you want to make sure they're on Ethernet connected line versus Wi-Fi, because we know the strength of the signal will be better and the quality will be better, right? And that you want to make sure that whatever security technologies, like I mentioned in bullet one, talk to each other, they're appropriate, and that if they are between organizations, that you want to make sure that all that has been cleared, and more than just IT, right? That they're compatible, so you can get that going, right? As we mentioned earlier, technical support is really an issue, and that when people are starting telehealth in different domains, especially in larger practices or clinics, or technical support is important at the beginning because invariably there are kinks and invariably um, certain individuals and organizations are more IT sophisticated or more technologically sophisticated. But having that available as you're moving along and how to do that within your budgetary constraints, especially if it's from an individual's small office or practice, is a challenge, right? That's an implementation challenge. We know that organizationally, so if you're in a big clinic and you're transitioning, it could create this paradigm shift, and this need to adapt can create issues. Now, we've lived it through this pandemic where individuals have been not quite forced, but certainly acted as a catalyst to have quite a few individuals transition to this out of necessity, right? It means, do I not see any patients? How can I provide my consultations or my care? And I'm kind of pushed in that direction. So I'm going to embrace that a little bit more easily because of the current needs and even the relaxation of some of the regs that facilitate that, right? But we know that in general, pre-pandemic, it could be a little bit of resistance, right? Some of that flexibility and changing paradigms and changing how services delivered. Oh my gosh, what are some more barriers? Well, I'm glad you asked. One of the most common thing that comes up when people looking to start providing telepsychiatric or telehealth services is money, right? And we know that that's a real issue, right? How are we going to get reimbursed? How much are we going to get reimbursed? Now, typically in any large organization, you would perform your due diligence, your focused due diligence, develop a business plan and look at that model, right? And see how that works, or you work at contracts to see how that works, and then cost it out as you're making that strategic and or operational decision. Do so, right? And then the fears both on the provider side or other payer side is that individuals are going to misuse the system, and that having it open, the proverbial Wild West, will lead to this whole overutilization and will drive up costs. We don't really know what's happening. You're having all these sessions and we don't know because you could do that anywhere, and there's less ability to have oversight and monitor whether those encounters and those services are really happening or not. And then as we've seen recently, there's been this whole proliferation of technologies that are being produced, right? And that people being attracted to the potential for money making, the opportunistic development and the launching of these technologies without really either vetting it or understanding the nuances or the applicability of telehealth or telemedicine, telepsychiatric services. And so therefore, that may lead to some potential issues that come up down the road, where then you're going like, whoops, this happened, or my vendor that I have really is not providing this, or come across more issues, right? Regulations. Now we know one is licensure, the other is practice regulations, right? So that the point of service, right? So if that child that grows up to be an adolescent, that adolescent goes off to college and they go out of state, most states require that you have a licensure in the state at that point of service, right? That even though you're in Florida, at that point of service, you need to be licensed or at least have some kind of certification from that state, right? But more than that, it could be whatever administrative or other practice regulations. It could be from your own organization. Okay, we're going to implement telehealth services, but that first visit, the initial evaluation, 90791, 90792.95 needs to be, not 0.95, needs to be in person. You can provide continuing care, but we need that initial evaluation to be in person. Now we know all these things were waived during the current pandemic, but as things roll out and we roll back to our post-coronavirus state of affairs, or it won't be post, right? Because it may not be a discrete episode, right? But we'll see how these practice regs and administrative regs bear out. And we are struggling with our own large clinic here locally as well, as to we go through what we want to, what we think would be the best standard of care to provide those services. And then the overpromise, right? Let's hype it up, right? Is it based on evidence, or is it, here we are, we're gonna provide all these services, and we may truly believe it works, but as we talked earlier, that the evidence base is still emerging, and there is good evidence to show the promise, but that we're not sure in certain subpopulations whether that's using telehealth or telepsychiatric services are the best. And I can tell you in practice, it turns out that way, right? If someone is very, very complicated, two varies, right? That maybe that wouldn't be the best modality of providing care, barring being an exception like an emergency or urgent issues, right? And that goes back to that evidence basis you can see, right? We know that it's really the focus people keep bringing up is about the technology, but it's really not the technology, it's the services, right? And how those services bring about change. So the technology is the vehicle, but it's really the service, right? So those, as we said, we try to replicate. We went through this with electronic health records, right? We go, gosh, here's the paper record. Let's just try to drop it into an electronic health record, and we see how clunky it is, right? All the fields are there, all the clicking, all the pages, and it's not as intuitive as one would like it, or as user friendly. And we're using in a lot of places a similar model. What we say, gosh, here's what we do in person and face-to-face contact. We're going to drop this into telebehavioral health, and it may work, it may not, right? So we will see, right? And we will see how that works, and especially as these services expands and what that does to issues like data flows and things like that, right? So what are some of the reasons people cite for getting into it? Is like because the consumers, the patients want it, right? The families want it, right? And we want to be competitive and attractive to patients, so we're going to start providing those services, and we're going to show you that we're 21st century providers, and we're on top of it, right? And that I think it's just as effective, so I'm going to provide it for you, like I said, right? And I can provide more flexible or extended hours because I don't have that commuting or transit time to go from clinic to home, so I can provide services for longer periods of time depending on the setting, right? Or even on the weekend, et cetera. And that to show that it's more of a value for the youth and the families, as well as a value for me, because depending on how much one provides it, as we said earlier, it may lower our overhead costs, right? And it may help us with more frequent contacts. Again, and there's maybe a change in the delivery of care, the paradigm shifts that, hey, I don't need to see you for traditional full 50 to 1 hour sessions. I could have different touch points, especially for more chronic issues, and therefore I could provide better care that way, right? So what are some of those fears, right, that people bring up, right? That, oh my gosh, but our staff doesn't know about that, and the patients don't have the savviness to deal with the technology of that, right? Or that, no way, the patients won't do that. That's going to affect our relationship, right? Whether it's the clinician, patient, the doctor, patient relationship. Oh no, they'll never accept that. They won't like that. They won't use it, right? Or that, gosh, up until now, it's been more difficult to get reimbursed, and it's been kind of a hassle, and it's viewed as obstructionistic, right? More fears include the startup costs, right? So obviously that there is a certain startup cost for telehealth for all involved in one. And again, it's not only startup, but there are recurring costs, especially depending on the video conferencing platform, the telehealth platform that you do utilize. Um, there's usually some kind of recurring fee, and that it may be too much, or I need to develop further existing computer and other equipment technologies to be able to handle this, right? And that, oh my gosh, this is going to be such a burden on all the providers that we shouldn't do it because it's going to be such a burden, right? And when you hear and you talk to the different families and you hear and talk to the different patients, you're going to hear a bunch of reasons why people say, oh, they're not going to like it. You're going to see, they're going to say, I respectfully refuse. Now we know during this pandemic time, it's less likely, but as things kind of begin to return a little bit more to semi-normal, um, or certainly before this pandemic, these were the kind of things you would hear. But no, I don't want to get online. I want to see my doctor. I want to see my therapist. I actually want to see them, right? Or that people report and families report sometimes and clinicians report that they feel, I don't feel comfortable. I don't feel comfortable looking at you through the camera. I don't feel comfortable seeing myself in that little square as well, a mirror. I don't want to do that. Or I don't know how. I don't know how to do that, right? I'm not sure how that's going to happen, etc. Um, Others include obviously ignorance, like, hey, I didn't know it was an option. I didn't know we could do that. I wasn't informed. And then lastly is cost, right? Okay, if we're going to do that, is it cost? Is there a savings cost to me if I am going to participate via telehealth, or is it the same cost? Is there more cost? What's the cost on my end as a patient or as a consumer, right? And so that over time has led to different questions one would ask oneself before starting, right? And I know a lot of you are already doing this, and some of you may or may not be there yet, right? But like, okay, how does it work, right? I don't know enough about it, right? So obviously, right? And then as part of your decision-making process and part of your business plan is, okay, I don't, how much do I get paid for it, or what's the reimbursement for it, right? Big question, is it legal? Of course, right? But how can I perform these telehealth, these telebehavioral health, these telepsychiatric services legally, right? And there are some individuals out there who are not quite adhering to some of those administrative regs, etc., right? And then, gosh, are there certain conditions that I should or shouldn't treat through telepsychiatry? Is it everybody? Hey, whoever it is, come on, right? Or not? Well, that's probably the same thing you would want to be reflective enough and aware enough of yourself in practice. If it was face-to-face, you would ask the same questions, right? Gosh, this goes out of the scope of what I do. For example, myself, oh, this is an eating disorder. You have this is very specialized, and I think you're best served by blank, 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 and I don't do this or that, right? So, and it's the same questions we work with the pediatrician, right? With the pediatricians and understanding and helping develop a core skill set to deal with some basic behavioral health issues like ADHD or some moderate depression. But when things become more complicated, whether it's part of SMI or more serious comorbid problems, that one should be aware enough to make a referral, right? What is that threshold, right? How do I do the interview through this, right? People ask that before they start, right? Or even, well, how can I start this, right? So in making several calls before this webinar, people learn quickly, right? They learn that how to get started. And then lastly, what's my liability, right? And that you should be speaking with your malpractice carrier as well, right? And the last one that you see out here, I mean, should I even take this on, right? Yeah, and out of necessity, a lot of individuals have taken this on recently, But prior to this, a lot of people were questioning, like, why do I want to even take that on? I need to, why should I, right? So now we're coming to my favorite section, right? And so, Oxford Dictionary every year puts out the word or phrase of the year. For example, in 2015, it was vaping, right? I predict that it may be Zoom fatigue for next year because it's such a new term. And I am in no way endorsing Zoom, but just like that branding happens with facial tissues and Kleenex and other things like that, Zoom has been embraced as a term and even as an adjective, as a verb, right? Are you zooming today? And that doesn't mean like certain circles something negative. It just means, are you getting involved in a meeting, right? So, and any individuals that are either working in organizations where there's a lot of meetings, or if you're doing a lot of direct patient care, or some combination thereof, teaching as well, right? Uh, you can kind of identify with some of this later, right? So, well, and so what are some of the reasons why? Well, because being on these meetings and these teleconferences requires a lot more attention, right? And it's more difficult now. Certainly with the webinar, where I don't see you all here on the screen, but in a clinical encounter, you're going to have the reciprocalness of seeing each other. And it really takes more attention to be able to look at those cues um, than you would in a face-to-face interaction. And it's even harder sometimes to even pick up. So here's a joke. How many times have you been on a conversation and how many days have you gone without hearing, can you see me? Can you see me? Hello? Hello? Can you hear me? Hello? And so, and this is new, right? Which you normally typically would not find in a face-to-face encounter. It reminds me of the old days with the cell phones and the services. We go, hello, hello, can you hear me now? Can you hear me now? So almost daily now, we're looking for those cues and we're trying to find that natural flow of the interaction, which is a little bit different. And obviously that leads the need to be more activated, vigilant during the interactions, during the clinical interactions, right? Or even your meeting, right? The second one is silence, right? So when there is silence or when people are muted and we're talking like we've all done, then people don't know what to do with that, right? In a typical face-to-face encounter, you could read that cue and know what to do with that silence. But in these telehealth or these Zoom meetings, you're not sure. It's like an uncomfortable pause, and that creates people to be really uncomfortable. And that clock goes a lot faster than you would in a typical face-to-face interaction, where you may tolerate that pause a little longer while you're appropriate, because it may be more appropriate. Whereas, hello, hello, oh yes, I was talking and I was muted and I didn't blank 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 blank. So silence is another factor that creates more stress because again have to be more vigilant and activated during the interaction. The third is awareness of being watched, right? So in most platforms, you have your screen off to the side, which you can turn off sometimes, but we're not used to that. We're not used to that happening. And I don't know of anybody who doesn't look at that side screen at least once or many times throughout the encounter, but you don't want to focus on your image on that screen, right? So we're not aware of that, and that's created a little bit more of this kind of showtime phenomenon, right? Hey, I have to be on. I have to sit up straight. I have to sit up straight like the newscasters and say, welcome to the 12 o'clock webinar news. And so this feeling of a performance of being activated can be much more stressful and draining, right? Because what happens after you're activated for an extended period of time, you deactivate and you feel drained, right? Like, oh my gosh, I'm off camera, and I can relax, right? So it can be more stressful, right? And then we know just the general zeitgeist of the times, the feelings of the time is much more stressful, right? And that it's created a whole disruption in our lives, and it's the forced disruption, right? And it can be a reminder of all the things we've lost, right? We've lost our independence, we've lost our ability to do this or that, generate income, whatever it is, right? But it's that reminder of being, especially individuals that have transitioned quickly to telehealth services, right? Kind of feel that a little bit more rather than individuals been doing that for a long time. And then it's really, really important because this is a big one, right? So most individuals during, especially now during this pandemic, are providing their telehealth services from home. There are a few who go to an office or go to their clinic, and even though it may be closed, but they will provide the services at a different space. But most individuals are at home, and that's that blending, that joke where what day of the week is it? Oh, and where you don't have that discrete separation from work and play, just like when you speak to any of the parents and there's that whole task shifting, like, well, I have to do my work or I have to do things at the house, but I also have to work on teaching and supervising the kids and their schoolwork, right? And there's this whole blending of things. So as clinicians, you feel like your space is not as discrete and as separate, right? Then individuals that have been doing this for a while and take that shift work and say, hey, I'm consulting to this correctional facility, not kids, right? But typically it can be youth detention centers or emergency department in other areas. A little bit better because they work shifts, right? They work X number of hours and they're able to really be discreet in their scheduling. But during this pandemic, our roles blend, right? So context is not the same, right? Am I on or not? Or, hey, I'm going to be closing up for an hour. I need quiet. Let me get to work and work on this, depending on where you live and who you live with, right? And so this has created a big issue, right? Because typically and classically, we would get up and go somewhere and be in a separate workspace and be in a separate headset. It helps us transition, right? It's part of that mental transition from a social or home role into a work role, and then we kind of activate. We get dressed. Individuals a lot of times don't change their clothes when they in these settings as well, so that it doesn't help them transition. So that's why you work with kids and you work with others and saying, hey, you're going to school, right? So you don't need to put on your uniform or whatever you normally would put, but you may want to put on other clothes to help you get into work mode, which is really important for kids with like ADHD. Other kids that are very internally driven can handle that and can activate and get their things done, right? And then, as I mentioned earlier, that feeling of being on, right? I'm being watched, I'm on camera, even though in a face-to-face encounter, it's you're there, right? And individuals are judging you and evaluating you and seeing you. With the camera there and the direct feedback of seeing your camera, you feel this more heightened sense of I need to do it better, right? And there's a typo there, quote unquote. I need to be at the top of my game. I need to really be doing more. And individuals who use these things for non-clinical interactions, like certain organizations feel like, hey, people can really see me now, and my job during these difficult times may be at risk. So I really need to make sure that I'm doing this great job. Hopefully, we're thinking that way all the time, right? But during these times, a lot of the insecurity, or the potential financial insecurity, has one put pressure on oneself to kind of say, oh my gosh, I need to make sure, I need to make sure, I need to make sure, because I don't want to be furloughed, right? I got to make sure, or I want to make sure the patients just don't, fire me, and that parent go to someone else to get those services. And then especially with this was when individuals get involved with telehealth, this is meant to be a way to improving things, right? Talked about that earlier, right? Both for the patients and for the providers, right? There's all these positive reasons. But as you can see over time, sometimes there can be factors that aren't always positive, right? And that you can feel like a little bit obligated. This especially plays out in the Zoom fatigue world where you have meetings, right? Where you have to go to meetings. Hey, we're having another Zoom meeting. It's like, oh my gosh, I gotta go. And it's different, or even socially, right? Like, okay, we're gonna have a party, but wait, I don't really want to go, but I guess I should go. Or the proverbial virtual happy hours. Yesterday was Cinco de Mayo, right? I'm sure a lot of folks had their virtual get-togethers and celebration, right? So that it becomes this blend of, yes, I want to do it, and there's a social and a positive component, and then a component where people feel like a little bit imposed on, feel that it's not as relaxing in this vis-a-vis video conferencing. And especially in big groups, right? In big groups, it's like, oh my gosh, everybody's watching me, not just one person, but everybody can see me, right? And as we know, depending on your platform, sometimes you see everybody and you could set it up, and sometimes you can't, right? So um, it's not always so. And these large formats, right? It can be particularly depersonalizing because you're just one person and you don't have the ability to necessarily interject as you would in person. And a lot of the kids complain, right, through their teaching that they don't get that feedback or don't have the ability to engage in an interaction with their teachers now, depending on their schooling and how it's done, but that this makes it more impersonal and they find it harder to sustain attention, engage in the teaching, find the positive value of it, etc. Right? And as I mentioned before, that even if it's a social or non-work thing, that sometimes people feel that it becomes like it's more of an obligation, right? It's not really just leisure. So what do you do? How do you alleviate some of those things? Well, sometimes you decide maybe I'll do phone calls, right? So you can do that clinically. It doesn't have to be with the video portion. You can say we're going to have an auditory check-in. It's appropriate in this kind of setting. If you're going in many settings, you define the ground rules, right? Especially if you're working with teens, right? You say, hey, does the camera need to be on the whole time? Well, you should at least see them for part of the time, most of the sessions, right? But you do want to have some ground rules beforehand, right? There's a lot of suggestion if the camera is very much right in front of you, like it is now, that can be more stressful over time versus if you off-center it and it may produce less fatigue. It may be less tiring as opposed to the camera looking at you right at eye level, which is what we usually recommend. That over time, it may be better to offset it sometimes, right? Sometimes you need it right at eye level, especially on some one-to-one interactions, and other times in more group formats, it's better over time to put it offset. Including me knowing when it's okay to turn it off, right? So you should really have that clarified for your interactions on that, right? And then sometimes you got to decide, hey, should we do that at all, right? Should we do that at all, right? Maybe not, right? And that just like you would in a regular encounter, whether it's a meeting or some other interaction, you may have some soft conversation before you engage in the task or the goal of the encounter, whether it's a clinical encounter, or whether it's a Zoom social call, or whether it's a Zoom meeting, because that helps bridge it, that helps normalize it a little bit, that helps provide the transition from here to there, and it ultimately helps alleviate and mitigate some of that Zoom fatigue. Right? So like Mark Twain said, telehealth, he didn't say telehealth, right? But that this is a process, and we're a process that we're working on continuously improving. So in summarizing, so we know that telepsychiatry and telebehavioral health is a valuable tool for children and adolescents, and especially for pediatricians and pediatric primary care, where we are trying to enhance access and improve services at their point of service and helping be more patient family centric by providing those services. And on that note, I am very much grateful for each of your participating, taking time out of your super busy day to participate in this um, this webinar sponsored by the University of South Florida. Thanks.
I have a question. I am curious as to your experience in seeing patients in their home as opposed to the office.
So yes, you mean so whether the family comes to a hub, a pediatrician's office, where they see them in their home, right? So we are part of this Department of Health contract where we're going to be working with the pediatric primary care practices and providing it there. So almost all our experience has been with in-home telepsychiatric care. And I can tell you that has really improved adherence or people following up with their appointments. And so, for example, in our own big clinic here at FIU, it decreased our no-show rate from 25% down to 5%. And in the private world, it's also led to a pretty good adherence with things, but it involves somewhat of a paradigm shift for certain individuals that weren't used to it from before, right? Most families have been satisfied with that care there. So I personally don't have as much experience in the hubs, but the feedback from the University of South Florida and their large program, where they've had quite a bit of experience, is that the families were also very grateful and happy with the care provided through the pediatrician's office, and all the pediatricians were happy as well, right?
How do you ensure that the patient has created a private environment for the appointment?
So that's a very good question, right? Because the clinician tries to facilitate it, but really, even though there's a shared responsibility, that responsibility falls upon the patient or the family, right? And a lot of times you'll go over that verbally, or you'll review that through your consent form, but that it's their responsibility to really ensure that where they're at, it's private, right? So that's a difficult challenge. So obviously the clinician sees anything that could be potentially limiting the privacy of the confidentiality that's discussed in the encounter. But ultimately, the larger share of that burden falls on the families or the patients or the individual receiving the service. All right. So I think on that note, I again thank the University of South Florida. I thank each and every one of you. I acknowledge how difficult it is for everyone out there, so I do appreciate you participating in this webinar. We hope that it's provided some value and some interest, or at the very least, maybe a tiny bit of entertainment for you during these difficult times, and we hope everyone remains safe and well. Thank you.